Hey everybody, Ultimate Oddball here. Today I'm going to discuss the results of a recent study on language comprehension and brain function in autistic individuals, which indicated that when autistic people lose their diagnosis after years of usually early intervention, it is not necessarily the result of that person no longer being autistic, but instead is likely the result of adaptations in the brain. The results of this study were based on MRI scans showing compensation in areas which were atypical to neurotypical brain activity. This fits in with the commonly held belief that forced therapies, such as applied behavior analysis, and others which force neurotypical mannerisms, don't actually produce the claimed or perceived benefit they purport to. Views on autism tend to be extremely negative, to the point that autism is stigmatized and autistic people are left feeling like humanity wants to be rid of us, would be happy to be rid of us. Because of these negative views, families of autistic people and autistic people themselves may feel an extreme push to force a change in behavior. Certain behavior can be obviously problematic, such as violence, but those behaviors are problematic in anyone, autistic or not. Therapies like ABA seem to be more focused on teaching autistic people that they have to fit into a tiny box of who and what a person is, and to be quiet and appreciative for it. The parents of autistic people who buy into the fear-mongering would like to believe that years of forcing behavior will lead to their child no longer being autistic. Many autistic self-advocates have categorically denied that this is the case. This recent study seems to confirm that experience scientifically. The pertinent question, as presented in the study, is this, quote, "To what degree does normative language performance reflect normative brain function?" End quote. Some early intervention therapies, especially ABA, are promoted as a way to help an autistic child catch up developmentally to non-autistic children. The study in question, and others, use the term, quote, "optimal outcome" to refer to, quote, "children who appear to lose their diagnosis and enter the normal range of cognitive, adaptive, and social skills," end quote. Those in the optimal outcome category achieved, quote, "normalization of essentially all basic language functions," end quote. This study shows that this normalization, though it has been promoted as being indicative of neurotypical brain activity, is in actuality likely the result of the brain rewiring itself in order to gain a better grasp on language. Research has shown atypical activation of parts of the brain with language use and comprehension in autistic individuals, indicating a compensatory action being the cause. Researchers in the study theorized that, quote, "early intensive behavioral treatments may work, not by normalizing processing pathways, but by teaching relevant skills until alternative neural pathways are recruited to achieve compensation." End quote. Basically, they believe that early intervention therapies may teach important skills which help until the brain is able to fully rewire itself. While some parts of the brain may be rewired in some autistic people, this is by no means consistent among everyone on the spectrum, nor does every part of the brain rewire itself in those situations where it does. While this study is intriguing, it was done on a relatively small number of participants, and more research is needed to fully understand the implications of early intervention and whether it holds the benefits which have been used to justify what many autistic people feel is unacceptable and oppressive treatment. Many of these therapies are extremely costly, both emotionally and financially. Any therapy which isn't necessary or beneficial should be done away with, and all proposed treatments should be carefully studied and considered. As we've seen time and time again with anti-vaccine fear-mongering and the promotion of products like MMS-CD bleach, the ableism against autistic people driven by stigma regularly motivates behavior which endangers and hurts us. Well, thanks so much for tuning in. Thanks for coming by. Have a good day. Hey everybody, Ultimate Oddball here. If you want to stay up to date with my videos, click subscribe. I release a new video on Monday, Wednesday, and Friday. I do gaming commentary and review. I talk about my experiences on the autism spectrum, and I share my opinions and thoughts on a variety of matters. My hope is that, through my videos, I can help to dispel some of the misinformation, confusion, and negativity people have regarding autism. Thank you for helping me do that by watching these videos.